Hello.
Hello, Lisa. How are you doing today?
I'm good. How are you?
I'm good. Hand hygiene. I'm Sam. I'm going to be your nurse today. I'm here to do a newborn assessment on your baby. Is that okay?
Yeah, that's fine.
Okay, awesome. So what I'm going to do after I do hand hygiene, I am going to check my baby's wristband, make sure that this is the baby that I want to be assessing, and I am going to move on and go ahead and start vitals. So I'm going to listen to pulse and respirations for a full minute each. They may be a little irregular, which is completely normal, and that's why we listen for 1 minute. And I'm going to take the axillary temperature, so under the armpit is where I will do that. I'm also going, while I'm listening, I'm going to listen to bowel sounds as well. While I'm listening, I'm going to try to keep the baby as warm as possible, just so that I can have maximum hearing. Okay, so after I'm done listening, the normal heart rate ranges from 110 to 160. The temperature ranges from 97.7 to 99.5, and the respirations range from 30 to 60. And like I said, it may be abnormal. They may also have a heart murmur, which can be considered normal in the beginning stages of life. Also, a side note, if my baby has not had a bath yet, I will wear gloves throughout the whole entire assessment because there may still be presence of vernix on the child. So, in this case, we'll say that my baby has had a bath. The next thing that I'm going to do, I'm going to lift up the baby's head and I'm going to palpate in circular motions on the whole entire scalp. I'm feeling for molding. I am feeling the anterior and posterior fontanelles, and I'm also going to feel the suture lines for any excessive overlapping or excessive gaps. I'm also going to look through the hair and look for any scratches, any bruising. I will also look for something that is called a caput succedaneum, and that is basically just generalized edema on the whole scalp, and that will just feel squishy. And I will also look for a cephalhematoma, which is a generalized area of swelling that is blood, and it does not cross the suture lines. So after that, I'm going to move down to the eyes. I'm going to look for any discharge coming from the eyes. I'm going to look for any subconjunctival hemorrhage. I'm going to make sure the inner and outer canthuses are lined up. I am also going to check, does each eye and the nose take up a third of the face, and that would indicate normal symmetry for the face. I'm also going to line up the very top of the ear, and it should be in line with the inner and outer canthuses of the eyes. For the ears, I will also check recoil. So I will pull down on the top of the ear and kind of fold it over, and it should bounce right back, and that's a full-term normal finding. If the baby was preterm, it may be a little bit of a slower recoil. The next thing that I'm going to do is check the patency of the baby's nares. So I will occlude each nare one at a time and make sure that they're breathing throughout the other nare, and do the same thing on the other side. Next, I will put on gloves and I'm going to check the mouth. So to begin, I can start by feeling around the baby's mouth to check for the rooting reflex. The baby should open their mouth, and once they do, I can put my finger in their mouth and palpate the soft and hard palate to make sure that it is intact. I can also assess the sucking reflex at this point, and the baby should suck on my finger. I will then take off gloves and do hand hygiene. The next thing that I'll assess is the baby's neck. So I'm going to palpate the baby's neck for any lumps, masses, make sure it feels symmetrical, and usually the baby will be alert, moving around, so in that way I can assess the baby's neck's range of motion. If not, I can manually move the baby's head from side to side to make sure that they have full range of motion. I am also going to check the baby's clavicles because it can be common to have fractured clavicles during labor and delivery. So I will palpate those and make sure I feel no crepitus, they're symmetrical, and just feel normal. The next thing that I'm going to do while trying to keep the baby warm is I'm going to assess the chest. So I already listened to respirations, but I'm going to assess for signs of not central cyanosis, for signs of respiratory distress. Central cyanosis is a sign of respiratory distress, as well as nasal flaring, grunting, seesaw respirations, which is asynchronous respirations, and retractions. Another sign would be apnea for longer than 20 seconds, and that would be abnormal. Okay, moving down to the abdomen, I am going to pull down the diaper a little bit so I can get good visualization. Try to cover up here a little bit. I'm going to palpate the abdomen. It should be soft, a little protrudent. There should be no visible masses, no palpable masses. I will also assess the umbilical cord at this moment. Is it dry? Is it moist? Is there any drainage, any redness? Yep, so we're good there. The next thing I'm going to do is move down to the genitalia. So I'm going to take off the diaper. I'm going to put gloves on. So my baby here is a female. I'm going to assess for anything in the diaper first. It's possible that there may be a little discharge, a little blood. That is actually normal for a baby girl because of the exposure to her mother's hormones during pregnancy. And this is a good teaching point to just let the mom know so she doesn't get startled while changing the diaper. If the diaper is soiled, I can change it at this time. So I'm assessing that the labia majora covers the labia minora, and that is normal for a full-term infant. And if this baby was a boy, I'm going to assess the penis and the testes. I'm going to assess the presence of foreskin. Maybe not. The baby may have been circumcised. I'm also going to check the urinary meatus. It should be on the very tip, centrally located on the glans penis. And I will also assess the testes to see if they have descended. I will just palpate with gloves on. And if I struggle to feel them at all, I can put a little pressure in the inguinal canal, and that should help me palpate. Throughout this whole assessment, I will be assessing the skin from head to toe, front and back. I'll assess the front first since the baby's not turned over yet. So what I'm assessing for is bruises, the erythema toxicum, which is the newborn rash. I am assessing for jaundice, and there are 5 places that you can check in a newborn for jaundice. This includes the forehead, the abdomen, the thigh, and the sclera of the eye. So you would want to check for that, and jaundice is also not normal 24 hours, like in 24 hours of the baby's life. It can occur after that. I can also assess for bruises, any scratches, because labor and delivery can get a little rough sometimes for the baby. I will check for birthmarks. My baby is a dark-skinned baby right here, and they may have a Mongolian spot. There could be, which is on the lower back. They may have, they also want to check for lanugo, which is the fine baby hairs. If the baby is full term, they will be pretty sparse, and there won't be lots. While I have my baby right here and not flipped over yet, I will assess each hand and each foot. I'm going to count each finger and each toe. There should be 5 on each. I will also look at creases on the palms. If it's a full-term baby, there will be lots of creases on both the palms and the soles of the feet. And if the baby has one single crease on the palm, this may indicate that the baby is Down syndrome. Another thing that can indicate Down syndrome is the epicanthal folds on the eyes, which I did forget to mention while doing the eyes. But if the baby has an epicanthal fold, that could indicate Down syndrome, like I said, or Asian. Okay. Next, I'm going to flip baby over and assess the baby's back. So I'm going to assess the baby's spine, and it should be in a straight line. There should be no deviation from the midline. I'm also going to pull down the diaper a little bit to look at the lower area of the back for a dimple, a tuft of hair, or a actual hole, and this could indicate spina bifida. So that's what I'm looking at on the back. Next, I'm going to do reflexes. So on the foot, you can do the Babinski reflex. You can go up the lateral side of the foot and then around the sole, and the baby should naturally fan out their feet like that. I can also do the palmar grasp. Just hold on to their hand, and they should clasp their finger around your hand, or their hand around your finger. Towards the end, I can do the Moro reflex, which I can either clap to startle the baby, or I can lift up their little bed and put it down, and they might throw up their hands and make a C, and that would be a normal reflex response. To make sure that they have good motor reflex, you can do the arm recoil test, which is putting their arm up, back down, and then they will naturally put their arm back up. And that's just a really good indication of their fine motor reflexes. So, okay, so I will take note of the baby's behavior throughout the whole procedure. And lastly, before I leave, I'll ask the mom some questions, such as when was the last bowel movement, when was the last void, and when was the last feeding. I can also assess how she's doing with breastfeeding. If she needs any help, I can help her get a lactation consultant and so forth. So, all right. Thank you.